Hi, this is Dr. O'Reilly. There's probably a number of things, but let's just call it the dozen things you want to know about your dentist before going in, because the trust and confidence is extremely important to have in place and for successful outcome of treatment. So, number one, where did your dentist go to school? How long has he been practicing? That's pretty basic and important. Number two, if your dentist is holistic, for instance, where did he learn his philosophy? Where did he learn his techniques? Did he go to special meetings? There's actually conventions every year by certain groups that teach dentists some of these issues and techniques. Number three, does your dentist have any kind of protocol when he removes silver amalgam fillings, the old dental fillings that you have in your teeth? And I feel it's very, very important how you remove that metal, that there's protection for you, that there's a rubber dam used, and you don't breathe or even swallow some of the fragments, the metal dust or fragments that's released during the dental work. Number four, is there any kind of filtration in the office for the metal as it leaves the office? For instance, when you know the suction tips that they use during the dental work, what happens to the metal that's sucked out of and into the water lines in the office? We have, in our office, for instance, we have a special filter that gets all that metal out of the water before it actually leaves the office, so the environment is protected from metal exposure and mercury. Number five, um, does the office see one patient at a time? How do they schedule the patients? I think it's really nice to have enough time and enough space to treat each patient as an individual and not try to stack patients against each other in the schedule. Number six, how much experience does the doctor have in terms of dental materials, and do they do any testing? There can be tests done, some blood tests are available to tell if you're sensitive to any dental materials out there. There's so many dental materials, hundreds of them and thousands of them. So there are things that could be done to determine what's appropriate in your situation for your body. Number seven, how is the office set up in terms of sterilization? Do they use a chemical type of sterilization? Do they use a steam sterilizer? How do they protect the instruments, bag the instruments? Is there extra barrier protection in the room itself where the work is done? You want to find out about sterilization issues. Does the office how do they do cleanings? You know, your recall cleanings. Do they have a hygienist? Does the doctor do them himself? In my office, I actually do the cleanings myself because I think it just provides for more continuity of care and complete care. Number nine, does the doctor have any adjunctive, for instance, lasers is a nice technology to have in the office for treating teeth and gums, especially gums, because it's very supportive. It can treat gum issues and resolve and heal gum issues, inflammation, pocketing, and it's very non-traumatic. It's very soothing and actually helps the gums heal. So you avoid all of the trauma that goes with some of this treatment, the deep cleanings, the dental gum surgeries at the specialist's office. So there are ways of improving and resolving gum issues and problems without short of surgery. Number 10, how does the staff interact with you? Are they very helpful? Are they knowledgeable? Do they understand some of the dental issues and for the questions that you have? You know, questions always come up before treatment, during treatment, and you want to be able to talk to people that really understand not only what you're going through, but how to give you the right information so you can make the right decisions. Number 11, what kind of education do they provide for you in terms of general dental issues as well as specific If it's holistic issues that you're interested in, do they have handouts? Do they have a pretty complete website? Do they talk to you a lot in terms of explaining and educating in the office? These are all important issues. Number 12, is the doctor networked with other specialists, especially if there's coordination that's accurate for your situation? How long has that dentist been working with these specialists? Whether it's like an orthodontist or a periodontist or an oral surgeon, it's important to have this kind of integration between the practitioners and the communication in place so that the treatment goes better and goes smoother. It's an important factor. So these are some of the things you want to get a feel for and get informed about your dental office, because they will affect your experience and they will affect the success and ultimately the quality of care that you feel that you are receiving. So I hope this is helpful, and feel free to call us if you need more information about your situation or have questions about these issues that we discussed today. Thank you very much. Talk to you soon.